So I think the thing you have to remember is that often the day that a patient first sees a neurosurgeon, particularly through the emergency department, is typically the worst day of their life.
I was at work, I'm a midwife, and I was at work in birth suite and just couldn't see clearly anymore as to what was going on, and just this sudden loss of vision, and thought, what's going on here? I can't see anything out of my left eye. Quite frightening, thinking this is, you know, I couldn't see anything other than shades of grey, and everything had become blurry in my left eye. So quite frightening for that to be happening at work. I was sent off for an urgent MRI. They were thinking that it might be multiple sclerosis, and the MRI actually discovered that I had a tumour in my pituitary area of my brain that was putting pressure onto my optic nerve. So if something wasn't done quickly, I was at risk of losing my sight. My surgeon, Nick Hall, he operated within the week and actually removed the tumour from through my nose, and was able to act so fast and so quickly that able to protect my eyesight, and actually have better eyesight now than I've had for years.
The patient journey has to be as smooth as possible, and it has to be as precise as possible. Asking a patient to go to another hospital to have another scan is just completely inappropriate in that situation. So having access to the appropriate investigations, which is largely for brain surgery, MRI, is fundamental.
I've had an ongoing journey now post the procedure where they've been tracking my journey with the MRIs, and the clarity of the pictures that they've been able to get here has been allowed them to see that there's actually a little bit of the tumour remaining. So later in the year I'm having some radiation therapy with that to make sure that there's no chance that it will come back again.
You know, it would be clearly inappropriate for a patient who has no choices to be faced with large out-of-pocket costs, you know, relating to imaging. So I think having access through Medicare for that vital, life-changing diagnostic, you know, imaging is a fundamental thing, and I think I'd be very strongly encouraging of the hospital to get that, because the last thing a patient needs is consideration of those issues when they're dealing with the worst day of their life.